Hello, my name is Megan, and I am a family nurse practitioner student at Eastern Kentucky University in NSC 842, and this is my presentation on the scope of practice for nurse practitioners here in the Commonwealth of Kentucky. So the scope of practice includes procedures, actions, and processes that are legally permitted for a nurse practitioner in the state to perform. These nurse practitioners are equipped with a master's or doctorate degree in nursing that include expanded clinical authority beyond the traditional nursing duties and are regulated by the Kentucky Board of Nursing under state law. The license requirements for nurse practitioner in Kentucky include an active registered nurse license, a graduate degree as discussed in nursing, whether that be a master's or a doctorate. You need to pass the national certification exam as well as be accredited from the national body. The clinical authorities that a nurse practitioner might oversee includes assessments, diagnostics, treatment, prescription authority, as well as additional legal authorities. For assessment and diagnosis, nurse practitioners are able to obtain a comprehensive history from the patient, go over physical exams, and independently order and interpret labs, imaging, EKGs, any studies or additional testing that might be required. For treatment, nurse practitioners can independently diagnose and treat acute and chronic conditions like diabetes, infections, hypertension, mental health conditions such as anxiety, depression, and develop evidence-based treatment plans. You need to have a license for controlled substances in the state of Kentucky, along with a collaborative agreement with the CAPA. And then some additional duties from a nurse practitioner might include performing office procedures like providing sutures or stapling, IUD insertions, and joint injections. Nurse practitioners here in the state of Kentucky are also able to sign death certificates and complete a disabled parking place card. There are some current challenges that nurse practitioners in the Commonwealth of Kentucky face, and one of which, and the biggest, is that nurse practitioners here do not have full practice authority. They have the collaborative agreements for non-scheduled prescribing that create administrative barriers for mid-level providers. They require physician oversight and limit autonomous practice, and there are significant provider shortages, especially in rural areas here in Kentucky. My proposed plan for these challenges include advocating for full practice legislation, expanding nurse practitioner deployment in rural and underserved areas to provide for the community gaps that rural areas have, as well as standardize education, national certification, and clinical competencies so that nurse practitioners are able to fulfill the roles that they are needed to here in the state, as well as increase nurse practitioner involvement in policy making, whether that be advocating at Capitol and reflecting current clinical evidence for up-to-date practice. Nurse practitioners are a vital part to Kentucky's healthcare system. They offer comprehensive primary and specialty care across the lifespan and aid in the significant provider shortage here. As healthcare evolves and the shortage persists, expanding the nurse practitioner scope of practice here would be essential for providing patient access, especially in rural communities or underserved areas. For nurses practicing in Kentucky, you need to be fluent in the Kentucky Nurse Practice Act and be up to date on regulations provided by the Kentucky Board of Nursing for safe, effective, and legally compliant care. My two discussion questions are: how will the scope of practice, as defined by the Kentucky Board of Nursing, impact your work in rural areas, especially considering the collaborative agreements that are required, access to care, and what changes you would advocate for? Question number 2 includes discussing the changes you would like to see within the scope of practice for nurse practitioners in the state, discussing more specific regulatory barriers, the national comparisons with full practice authority states, and what changes could improve outcomes for patients, especially in underserved and rural communities.